Since it is recessive, you answer the question. Since it is recessive, autosomal recessive, so it could be carrier when you are heterozygous, or disease when you are homozygous. Very simple, very easy. This child is complex diseases. Complex diseases is not caused by one gene. It could be caused by multiple genes, up to 100 genes. This does not follow Mendel one gene. No. Each one of these genes contribute a little to increasing age, the risk of development of that disease. Now, you tell me, what diseases are these? What type of diseases are these? I ask you, give me an example of a disease. Which first disease comes to your mind? 60% منكم راح يموتون بالقلب إن شاء الله. إن شاء الله إجت بعد مجال ها؟ فمو معلومة إن شاء الله أقولها إيش على هذا لو على مش معلوم. Cardiovascular disease. Is it Mendelian? It's not. It is a complex disease. What other disease you think of? Congenital disease. Is it Mendelian? No. It's complex disease. What other disease common? Diabetes. 2 من كل 5 diabetic. Is it a Mendelian disease? No. It is a complex disease. Asthma. Neurological diseases. Can you see? When we talk about monogenetic diseases, Mendel disease, they do not constitute more than 5, probably 5%. But when you talk about cardiovascular, it's 60% of people have cardiovascular problems. Diabetes, we're talking about 30 to 40%. So, big diseases, the diseases which we see in the hospital, they are usually due to age to death. Complex, polygenic diseases. So a polygenic disease, it means age, genes located at different loci. يعني مش gene on the same chromosome, different chromosome, different genes, non-allelic genes. Different loci contribute to the etiology of their condition, whether it is a disease, whether it is a trait, whether it is whatever it is. For example, fingerprint ridge count. After week 19th, you make the thing in embryo. Week 19th, that fingerprint will develop for the child, for the embryo. And it stays with him to the day he dies. It doesn't change. It doesn't change. That is developed by over or influenced by over 43 genes. كل وحدة contribute a little. So if somebody asks me, give me a polygenic, listen to me, polygenic, not anything else yet, polygenic, I will say fingerprint. You understand? There is no changes. That changed with me now. It changed. Yeah? Why? Because I use a lot of pen, my fingers, I use them a lot, and there is an atrophy. You understand? So I don't have a fingerprint. فلهذا مشكلتي بالمطار كل ما اجيت ما يشتغل يقول لي خلي ما يشتغل خلي ما يشتغل يا رجال خلي ما يشتغل خلي الثاني ما يشتغل. And I spend 10 minutes there, and every time I come to the airport, if I want to get out, I'm the last one. If I want to come in, I'm the last one. But it doesn't change. That is atrophy. That didn't change because of this is environmental effect, which is 80% of it is due to age 2. So that's a polygenic. You understand? That's a polygenic trait, if you want. There's something else called multifactorial. Multifactorial. All multifactorial traits or diseases are polygenic. Like there is an additive factor influencing it. In this case, is environment. So this trait or this disease, this condition, is brought about by multiple genes plus environmental factors. We call them as multifactorial. Multifactorial. يعني I think that is the only example which I can say is purely polygenic. If it is. You understand? Then I don't think there is a disease which is polygenic which does not have a environmental effect. But let's accept that this is a polygenic. So multifactorial effects of multiple genes influenced by and pre and postnatal age environment, such as trait, height, skin color, blood pressure, diabetes, influenced by environmental factors. Skin goes darker if you live in a sunny environment, goes lighter if you live in a cloudy environment. Blood pressure, depending, what do you eat? Sorry, what do you eat? Are you stressed? Are you not stressed? So it is environmental factors either. And these are known as multifactorial. Polygenic disease is defined as a disease thought to be caused by the effect of age 2 or more genes. Multifactorial, the same, plus age plus environment. It shows you the locus, and what's happened to disorders which show multifactorial inheritance do not follow Mendelian. Remember? Do not follow Mendelian. Cliff lip palate, congenital heart defect, heart problem, spinal bifida, polyrodic stenosis, acquired asthma, autism, epilepsy, diabetes, hypertension, ischemic heart disease, manic depression, schizophrenia, and cancer. Fiedland who? These are the biggest diseases. These are the ones which you see in the, in the hospital. If you live in Khobar and you go to the visit the hospital, our hospital, university hospital, probably you will not see a sickle cell anemia in a month or 2 months or 3 months. You understand? But you will see cardiovascular age every day. So these are the big diseases. And they are all multifactorial. Multifactorial. Multigenic inheritance caused, as we said, by a number of diseases. Each contribute a little bit زائد mean environment. Such, for example, height. This is a very good example. Height influenced by a series of single nucleotide polymorphism. You remember? The SNPs, SNP, single nucleotide polymorphism. You remember we said you have this and I have this and this is called polymorphism? Remember from the previous lecture? So it is effect or influenced by these genetic polymorphism all act additively. 80% of it is age affect the height. So genes. So 80% of my height is being influenced by my genes. 20% is influenced by environment. For example, diet, whether it has protein, whether it has vitamin D, whether it has vitamin A, whether it has enough calcium. I don't drink milk. I hate milk. You understand? Determine final height, 20%. So there are environmental factors and there are polygenic factors. Obviously here, the polygenic factor is far greater than environmental factors. Multifactorial trait is said to be continuous, meaning quantitative, or discontinuous, meaning qualitative. Let's see. Quantitative is one which does not have a discrete phenotype. All our height the same? Is there a discrete one? مثل الدنيا كل واحد الهايت مالته 1.5 والثاني والقسم الثاني do we? We don't. If you look at us all of us, probably we differ completely in height. You understand? So there is no discrete number. Does not have a discrete phenotype, height, weight, blood pressure. Even in the same family. Can you see? Even in the same family. There is no discrete number. كل واحد يختلف. This has the continuous, which is known as qualitative, has a discrete phenotype, such as, do you have diabetes or don't you have diabetes? How many? 2. You divide us into 2. Some of us who have diabetes, some of us who do not have that. Or is it? Some of us have, some of us do not. Left and right-handed. I heard. Only 2. Discrete. There is one. You understand? There is only 2 kinds. مش مثل ديك 1,000 kinds. 2 kinds. Do you know these people? President, huh? President of the United States. And look at them. All of them are. So how many left-handed here? Left-handed. ما في؟ خلاص في أمل تصير جمهورية اليوم. Left-handed. This is a qualitative. You know, there is a discrete. There is more examples of that. Look at this. Well, we'll come to it in a minute. The continuous, you know, the continuous multifactorial trait, the one which has no discrete, and we said, example, height, intelligence, blood pressure, skin color, response. يعني if you plot the height of people, you will see there is a curve, a dumbbell-shaped curve. Yes? من الأصغر إلى الأعلى وبعدين إيش؟ صحيح ولا؟ That's it. And if you do the blood pressure, the same skin color, the same. You understand? Woman, men, dumbbell-shaped. But if you do the qualitative, do you have the same thing? No. Do you have? You have like this. For example, this is blood pressure. You're A, B, or O. 4 kind. Do you have a dumbbell shape? You don't. Do you understand the difference now? Between continuous and discontinuous is. Does not mean you have 2 kinds. You could have 3 kinds, 4 kinds, 5 kinds, 6 kinds. ما في مشكلة. But they are not going up like age in a progressive way, you know. Go on. Huh? كيف؟ إيه في معيار إنه يصعد continuously, you understand? And come down continuously. While this, no, doesn't have. واحد يمين عيون أخضر وعيون أزرق وعيون أسود. صحيح ولا؟ This is the same. You think discontinuous or continuous? العيون, color. Discontinuous because there's only 2, 3, 4 kinds. صحيح ولا؟ Anything which has a limited number, specific. Multifactorial disorder affect children may have normal parents, meaning 2 normal parents, suddenly have a child with a disease, with a trait like this cliff lip-up. Why? Can you explain it? I'll tell you how to explain it. This child is going to be made of genes of the father and genes of the mother. Genes of the father diluted. Not all the genes which lead to that he has. Genes of the mother diluted. Not all the genes which she has lead to that. But if you take both genes and add them together, now the child has a full span of all genes which could lead to age, to that type of condition. The father and mother are normal, but the child is. Why? Because each gene contributes a little toward age, toward development of that condition. فإذا عندك شوية منهم ما راح يبين الديزيز، إذا عندك كثير منهم راح يبين الديزيز. So the child must have inherited both father's bad genes and mother's bad genes, and resulted in having the condition. Environmental risk also involved in that because these are multifactorial, yeah, including nutritional deficiency, smoking, and alcohol now is being proven as well. Mothers who smoke, mothers who alcohol, have a higher tendency to have children with a triplet palate. Risk greater of more than one member of the family طبعا. Meaning we have plenty if that يطلع مش طفل واحد طفلين معناه there are plenty of age of this gene available in the family. So the greater it is, meaning the more genetic involved. If we're talking about penetrance, you remember I told you what I told you about penetrance? If you have 100 people who have a mutation in, for example, BRCA1, which lead to breast cancer, much 100 will develop breast cancer by the age of 50, only 70% will develop breast cancer. This is known the penetrance for age for BRCA1. BRCA2 is 40% penetrance, meaning out of the 100 who had the mutation in that gene, which lead to breast cancer, only 40% develop the disease. It's called 40% penetrance. Colorectal cancer is added 100% penetrance. Now you tell me why? Because obviously there are other genes, which we will see later. Other genes influence. You understand? Whether you have it or not. So you see, out of the 100, 70 develop breast cancer, 30% do not develop breast cancer, which makes it more difficult to diagnose which patient at higher risk and which patient is at lower risk. So it is quite complex. Risk is more than one in the family. If the disease is severe, risk in the family member is increased. The more severe, the more age of the bad genes, of the bad gene has been inherited. Disease may occur more frequently in one gender. If you see a man with a breast cancer, which is uncommon, that means it's extremely bad. I expect all the females in his family will have breast cancer, because it is a rarer thing. Risk decreases as the degree. If you have a brother, if you have a sister, and sister has a breast cancer, you have a high tendency to. If you have a cousin who has breast cancer, the risk is you have cousin of the cousin. As you go further away, the risk decrease. You understand? Coronary artery disease has all of the above characteristics. كليات اللي قلناها happen in coronary. Isolation of familial, member, risk in males, ethnicity, what country you are from, we will talk about that later, obesity, cholesterol, diabetes, cholesterol level, diabetes, and so on. Has all these characteristics of the thing. Why I put her picture here, you know who she is? Angelina Jolie. She's one of the famous actors in America, top superstar is called. Her mother died of a breast cancer. Her auntie died of a breast cancer. And her auntie from her father was diagnosed with a breast cancer. So she thought, خلاص, أنا باقية. She went and tested herself, genetic testing. And they found that she is carrying the pathogenic mutation which her mother has in a BRCA1. Which means it means by the age of 40, she will develop breast cancer. She has mastectomy, remove the breast. This resulted in her risk to go below normal. If the normal is 10%, she went below normal at 1 or 2% of risk of developing age breast cancer. Now you tell me, so what? And I go like, so what? You doctors, aren't you? Going to be doctors, inshallah, and you're going to advise people. How many people do you think they will listen to you? None. You're lucky if 1 or 2 listen to you. You understand? People don't listen to doctors. This lady, when she did that, over 100,000 in the first week, 100,000 ladies in the United States went and did the test and found that 5,000 of them have age, the same mutation. And she, all of them did age mastectomy. So what she did, she saved 5,000. You think you saved 5,000 in your life as a doctor? You might kill 5,000. So she contributes more than age than doctors together. Multifactorial disorder, these are examples. I'm not going to ask you to learn them all, but at least you learn the 2 of each age, of each kind. Just a name, you know? Even if you don't know what it is, it doesn't matter to me, except the one which I am explaining. These are, you need to know some of the names there. Neurological disorder. What neurological disorder, you know?
Parkinson.
What is it? Alzheimer? Dementia? You name it. Every name, every disease, neurological disease, you know it is there. You understand? They're all multi-age, multifactorial. Recurrence. What we in genetics, when we talk about recurrence, in hereditary trait or disorder, it means age. It means recurrence in the same family. Like sickle cell anemia. You have a child with sickle cell anemia. What is the recurrence of having another child with sickle cell anemia? That's what we mean by recurrence in genetics. Distinguished from recurrence, for example, in cancer. In cancer meaning which is chance that the cancer which is being treated comes back again to the same person. In genetics, recurrence meaning about 2 different persons. In cancer, in here, meaning age, to the same person. He has lung cancer, you treat him, 3 years later he comes back with the lung cancer again. This is what we mean by recurrence in these diseases. The recurrence risk for multifactorial condition is usually based on information collected from big observational population, from a big population. You understand? Affects individuals and families. The recurrence risk is higher if risks are specific to each disorder and may vary between population. يعني ما في recurrence risk for one disease. There is recurrence risk for each disease. You will see in a minute. More than one family member is affected. The more members affected, the more recurrence risk is you have. The higher recurrence risk you have. The affected individual of less common, as we said, for example, in breast cancer, meaning you have a higher risk. The severity of the disease is higher in that individual, meaning because of penetrance, remember, disease severity could be different between 2. I gave you polycystic kidney disease. Some people make only 1 cyst in the kidney, some people have 10 cysts in the kidney. Different, you know, according to the penetrance of the thing. So the severity, the more severe it is, the higher the risk of age recurrence. Can we calculate it? Yes, we can calculate it. Very easy. The risk of recurrence in the first degree relative can be calculated square root of incidence of the disease. So if you have a population with incidence 1 in 1,000, recurrence risk is square root of 1 over 1,000, 1 over 32, so 30%. Yeah, very simple calculation you could do as long as you know the accuracy of age of the incidence age in the population. So we could do that. So you should be able to calculate that, shouldn't you? You know, if I give you the incidence, population incidence, If the population is as this, you could work age the recurrent risk. You need a calculator, yeah. Sahih? Okay. I'm not going to comment. Heritability. It means age. Heritability, it means how much of the disease is due to your genes. Heritability is the proportion of the variability in the trait that is due to your genetic rather than environment. You understand? It's the polygenic risk, meaning how much is due to the genes and the rest could be due to environment. Example, lipid level varies across the population, but less so between family members. It has environmental, that's why it is different in population, but it's the same family, they are very close because heritability. They have the same genes. Understand? So you expect them to be lung cancer is low heritability. Mainly environmental. Due to me smoking. Breast cancer, very high heritability. Is it due mainly to age, due to genes? The breast cancer genes. And we have plenty of breast cancer genes. So if you look at diseases which are, listen to me, which are very high, autism, body fat percentage, rich count and fingerprint, high, very high age heritability, many genes, risk is, or the trait is due to age, influence of many age, higher percentage of genes. And we said the rich count doesn't change, 80% of it, fine or not? High, 60 less than, greater than 60%, 65%, but a lot less than the 90, asthma, DMR, cliff, spina bifida. Medium, blood pressure, multiple sclerosis, and look at this. Myocardial infarction, in where? In female. Just to show you a bit more. Low, myocardial infarction in male. طبعا contagious disease, but microbiology, bacterial is very low, that's not inherited. Sometimes it is inherited due to your age, immune system, but usually it's not, so it is very low. But look at this. Myocardial infarction in male has low heritability compared to age, compared to female. So you expect, therefore, female to be age at higher risk than male. But they're not. They are not. You understand? It's more male. More, I'll explain. More male than female. You understand why? Because we eat, our habit of eating is different to females. That's one. Second, cholesterol to me is not like cholesterol to the female. Female has all the steroidal compound which she used for progesterone, I don't know what, you understand? So there is less effect of cholesterol on her than on me. Stress, male tend to be more stressful than a. So there is more environmental factors in male than in female, even though the female have more heritability, in the case of myocardial infarction. ما سامع المثل يقول قالوا له مات قال ليه قال مرته أكلت قلبه. That's what it means. So it is true. You understand? Genes. It is multifactorial, but the more gene than environment, and sometimes more environment than genes. But both of them, yeah? Both of them. I told you, there is no really polygenic disease, which is purely polygenic, except age, I said, fingerprint ridge. Yeah? That's the only one which I think you could tell. So you could see that. Now, how did we know that? You understand? How did we got to this heritability? Is by this type of studies. Twin studies and adoption studies. Understand? It's not your child, you adopt a child. Twin studies. Twin studies, the twins, either they are monozygotic, meaning one egg divided into two. But they genetically are the same. Sign or not? Dizygotic are from two eggs by two different sperms. Divide, but two different sperms. So genetically they are different. So if we take these two identical, monozygotic, and put them in a place, in the same environment, one of them get the disease, one of them does not get the disease. Or both of them got the disease. What do you explain it? Is it genetic or environmental? Genetic, if both develop, is genetic. If one develop, one does not, this is environmental. You see? So we could tell by that type of thing. And in the case of dizygotic, or we take these, take them to one place, the monozygotic, the identical, take them one place, one another environment, and both of them have, let's say, we say it's a genetic. If one of them have not, it's an environmental factor. So that's why a lot of twin studies got us all this explanation of what's happening with people. Dizygotic twins arise from fertilization of two eggs by two different sperms. You understand? So genetically they are different and are different from each other genetically and are any other sibling in the family. They're different from all other families. If both twins share a trait, they are said to be concordant. If they are said to be discordant, if they don't share the same trait. You understand? يعني الصفة اللي يختلفون فيها we call them discordant. Studies of concordance rate in a twin can provide useful information about the genetic contribution toward of a disease. Example: autism, pyloric stenosis, diabetic mellitus, and coronary artery disease. Look at autism. It's a neurodevelopmental disorder. You know what autism is? Affects 1 in 2,500 children. Onset within the first 3 years of life, by the age of 2. إذا ما سكتوا بطلعهم. You understand? Listen to me. Absence of verbal communication, lack of social responsiveness. They're quiet. You can't talk to them. They don't respond. Twin studies suggest there is a genetic component. Concordant in monozygotic, 80%. It means age. It means a high heritability. Genetic influence is extremely high. Environmental effect is low. Monozygotic, no. 3%. Concordant, 3%. Which shows you it mainly genetic rather than environmental. You need environmental as well. I'm talking about age now. Which one is the highest influence? In this case, familial aggregation, which shows you it is in family, therefore it must be genetic. Study shows 15 susceptibility loci. Each makes a modest additive contribution. So there are 15 genes, minimum يعني. Loci could have more than one gene. But let's say كل واحدة بيها one gene, so there are 15 different genes. Each one added. How many you inherit? 6 of them? 7 of them? 8 of them? 9 of them? You understand? The severity becomes more and more. Pyloric stenosis. This is the pyloric stent, which is, look at it, thickening. That's the normal, you can see it, thickening, which makes it difficult for the food to pass it through to the intestine. Lower portion of the stomach that connects to the small intestine is known as the pylorus. Pylorus stenosis, the muscle is thickened, enlarged, narrowing the opening of the pylorus and eventually preventing food from moving to the intestine. Cause forceful vomiting, they always vomit and therefore associated with dehydration. Second most common problem, requiring surgery in newborns. So it's quite hard. You understand? If it is, which babies are at higher risk? We found 2-3 in 1,000 infants. Babies 2 to 8 weeks are at the highest risk by the time they age 8. Most frequent in American, Caucasian, European. Boys' risk is 4 to 5 times greater than girls. And you say why? You understand? And you say why? Obviously, there are other genes influence, which I would come to it later. Maybe inherited. Several members of the family may have had this problem in infancy. 25 to 40 concordance rate in monozygotic. It is due to some genetic, but environmental factor has also age influence. Environmental factors have also influence. Diabetes.
بعض الامراض يكونهم يكونوا continuous. كيف اقدر احسب الهيراركي حقهم اذا كان
That's nothing to do continuous, discontinuous, that nothing to do with heritability. You understand? Continuous, discontinuous does not have a phenotype, a specific age phenotype in continuous. Discontinuous have a specific phenotype. Yes or no? You understand? Heritability, no. We're talking about how much genes contribute. Now, it could be continuous or it could be discontinuous. IDDM, insulin-dependent diabetes mellitus. This is the juvenile, which affects the children. Juvenile onset. 4.4% of the population. Very serious. A child is very difficult to get into age to adhere to what you want to tell him. Renal problem, retinal problem, vascular complication, heart complication. You understand? So we have quite a bit of complication with that. Type 2, non-insulin dependent diabetes mellitus, which is known to be maturity onset, hit people at the age of 50 and above. Mature onset, 5 to 6% of the population. Look at that. It's huge. I think here is about 20% now they're talking about. In Saudi Arabia, type 2 is about 20 to 25%. Relatively age, benign. Benign provided you follow age, you follow instruction. Otherwise, it is as serious as age as the first one. And a lot of people have really the serious effect. This shows you the retinopathy. Retinopathy is one of the symptoms of type 2 diabetes, where they become blind, spontaneously blind, and this is normal retina. And look at here, there is a lot of hubub here, you understand? A lot of proteins which has to come out of solution. Now, concordance in monozygotic, 50%. Meaning age. Meaning 50% of type 2, type 1 diabetes is age genetic. And diazygotic only age 12%. More than 18 diabetes predisposing genes, more than 18 genes, which we know 10 years ago. Now we reach about 35, 40 genes involved in development of type 1 diabetes. Only major histocompatibility, this is again double 10 years in chromosome 6, you understand, which said that it is involved or it is related to the age, to the development of type 1 diabetes. The products of genes are believed to interact in a complex and poorly understood way, we don't know, you understand, to confer susceptibility to the disease. This is type 1. Type 2, look at it. 80%. So who's more genetic factors in it? Type 2. A lot of people thought it is type 1, until we find out 20% in dizygotic. Environmental factors, one of the major environmental factors which we know associated with type 2 diabetes is low birth weight. So all these children which are born with a low birth weight, they are at a higher age, risk of age, developing type 2 diabetes, they have more of the gene. Studies of identical twins in which one twin had developed type 2 diabetes shows that this twin is likely to be of lower birth weight. Diabetes increasing in prevalence ومصيبة عندنا أنا أقول لكم 20%. That 4% is in Europe. Here we are 20%, which is really, really scary. Yeah. Genome Association study identified this zinc transporter gene. This is the gene which is responsible for taking the insulin signal from the outside to the inside. Remember I told you about muscle? Huh? The muscle, I said, the problem with it, resistant. Glucose get into everywhere except the muscle because you need insulin. Remember that. So that is zinc transporter there.
This means that
More genetic than type 1. It comes at a later age. Coronary artery disease, this is major cause of morbidity and mortality. 60% of people have. 50% of death in developed country. In Europe, 50% is due to heart problem. Results from atherosclerosis, lipid deposition, and we said lipid deposition not like that, it's not as simple as that, it's far more complex. We showed you, this is a lipid from, this is the entima by the way, and this is enter the entima, where they proved it, you could see, which narrows the arteries, especially the coronary arteries, and result in problem of cardiomyocardial infarction. Environmental risk factor, poor diet, cigarette smoking, stress, and so on. Incidence varies between population. Western have 6 times more than Japanese. شايفين؟ يعني diet of the Japanese is far better than the European or the American. During World War II, some of the Japanese immigrated to America. After 1 or 2 generations, they became exactly the same as the American. They started 6 times or became equal in risk of developing. معنى ايش؟ معنى the environment. ماكدونالد ما كان موجود بالهذا وراحوا هناك وكل ماكدونالد على كيفه. Understand? Suddenly they became at a higher risk, the same way as the American, which shows you this is environmental factor. This is environmental factor. Migration study showed that Japanese people moving from low risk area to high risk area acquired the higher risk within 10 to 20 years. يعني this is clear, shows familial aggregation in families, occurs in families. Coronary artery disease, twin study concordance 39 to 48 monozygotic twin. So there is genetic influence, but mainly environmental influence. In dizygotic, look at it, 15 to 20%. Low concordance rate for monozygotic twin supports the importance of environmental factors. A lot of people now don't have cardiovascular because we start telling them to change their lifestyle. Mainly epistasis. Remember I talked about and I said I will say later on, which means why penetrance in certain genes 70%, and certain genes 40%, and certain genes 50%, and certain genes 100%. Why? It's all because of this effect, which is known as epistasis. What is it? A type of gene interaction where an allele at a particular locus alter the phenotype expression of another. Look at it, non-allelic gene, مش the same, non-allelic gene. يعني one gene influences the expression of another gene. So you might have the gene, and it goes, for example, 6%. You don't have this influencing gene, mutation in the influencing gene. So you still 6%. You have a mutation which increases the activity of this. So this leads to higher out. The action of one gene is modified by one or several طبعا other non-allelic gene. Interaction can be either synergistic, meaning increases its activity, or antagonistic, meaning decrease. suppressor gene, let me see if we have it here, this cancer suppressor gene encodes the genetic factor that prevents expression of allele at the second loci. Phenomenon of lack of penetrance, what I told you, lack of penetrance, yani zero penetrance, in which a dominant gene fails to be expressed, is often due to epistasis, because there is another gene which influences it. There are many cases where dominant disorder, such as polydactyly, these who have extra fingers and toes, appear to skip a generation. Meaning the influencer gene wasn't there. Influencer gene or genes weren't inherited in a similar way. Example of epistasis. A common example occurs in individuals who have sickle cell disease. Our patients with sickle cell disease, when they are born with 50% of their blood known as fetal hemoglobin. Adult hemoglobin is alpha 2 beta 2. Fetal hemoglobin is alpha 2 gamma 2. In sickle cell anemia patient in Africa, they are born with 4% fetal hemoglobin. These people the disease on them appear on the first 2 weeks, and then these are sickle, requires treatment, like that. While our patient, no, nothing. They are as they are, normal. And they could continue normal till the age of 20, 25, 30, normal. Because as they get older, the influence, which is gamma globin, decreases. So he's born with 50. After 5 years, it goes down to 40, 45. That's not a problem. He's still safe. After another 5 years or 10 years, he goes down to 30. Still not a problem. That is enough gamma globin there to transport the required oxygen for all his tissue. After 10 years, when it drops below 25 or 20, I calculated here for 18.5. If it goes below 20%, then the symptoms of sickle cell anemia start appearing. There isn't enough now fetal hemoglobin to inhibit polymerization of sickle hemoglobin. So this is an epistasis effect. You understand? This is an epistasis effect. Some children go down, born with 30%, and go down below 15% within 1 year or 2 years, 3 years. And we put these children straight away on hydroxyurea. Hydroxyurea is the only drug. What does hydroxyurea do? Hydroxyurea influence gamma globin gene, increase expression of gamma globin gene. Because gamma globin gene tend to switch off. This one is switch it on back again and let it work producing high fetal hemoglobin. As long as the child has high fetal hemoglobin, he is okay. Once the fetal hemoglobin drops, she is in trouble. So this is so some patient, the amount of fetal hemoglobin is significantly increased as a result of unknown mechanism, which results in gamma globin being high. Summary? Did we finish? Oh, I have 1 minute. Summary: polygenic characteristics of disorder are controlled multiple genes. You understand? Too many genes. Multifactorial disorder are multiple genes in an environment. Identical twin develop from the same difference attributed to genetic, you understand, or environment, depending where you put them. The term epistasis refers to modification of the phenotype expression of a gene by another gene. You have a question? You have 10 minutes break and come back 10 minutes exactly. And if I are,